Okay.
Yeah, let's start.
30-year-old woman presents to the gynecology outpatient department with a 6-month history of urinary urgency frequency, but no urge incontinence, or nocturia. The GB letter states that urine analysis done last fortnight reported negative.
Okay,
Kind
so she has
urge
urgency
and
with
frequency.
no UTI.
Mm.
He is he wants the investigation.
After blood culture were negative ولا urine analysis؟ هو كان urine
No, urine
analysis.
analysis. Why go do for blood culture? We have first to do urine analysis. Urine
Okay.
analysis is good. So what's
negative.
next?
وهي عندها urgency and frequency.
So what is the diagnosis? What are you thinking?
Urgency. Your urge incontinence maybe. So blood diary. I will do blood diary.
Bladder, not blood.
bladder diary. bladder diary.
Yeah.
sorry معلش لسه راجعة. طب
Okay.
اقرا بقيه اقرا كده بقيه الاوبشنز. blood culture.
This is look. Let's not waste our time. It's bladder diary, and
Okay.
I will show the answer. This is the explanation.
Okay, bladder diary help to ascertain the type and the quantity of ingested fluids and association with urinary symptoms. As she doesn't have urinary leakage, dry, overactive bladder may be managed with symptom diary for confirmation of the diagnosis and the patient feedback with lifestyle recommendation before commencing medication. Blood diary and maybe the treatment after confirmation
Bladder
of the
diary.
diagnosis. Bladder diary.
Bladder.
Okay. طب you say هنا عشان هو urge incontinence و after that urine analysis negative ف bladder diary it is the second step after
Look, bladder diary, she will be able to know what she is taking. Maybe she is taking more fluids and more, or she is taking a lot of caffeine. She with bladder diary, we can change her habits with bladder diary as well. That's why he is telling like bladder diary may be diagnostic and curative in the same time, because if she like noticed she is taking 5-6 cups of coffee a day, she can decrease this level. Okay, so next question.
Next question. 72-year-old woman present to the GB with presence of blood in her urine over the last 2 months. She has no fever or any other systematic symptoms. Routine analysis shows blood +3. She feels quite well and she has been brought to the GB reluctantly by her persuasive daughter. The patient apologized for being an incompetence. Translation. So reluctantly and persuasive.
She comes here reluctantly. That means she didn't want to come. Like she is hesitant to come. Her persuasive daughter, like her daughter, told her, no, you have to go. We need to check this. This may be dangerous.
So she's 72-year-old.
Yeah, and she's 72
and she is symptomless. And she has no
72?
pain. That's why she doesn't want to come. So this is more in favor of cancer, na CA.
Yeah.
And she has hematuria. Her age, her hematuria, and no pain. That's why she doesn't want to come to the doctor.
So you are thinking about malignancy. What will you do for malignancy?
D. Cystoscope bladder biopsy.
No. This is not your job to do this.
referral بقى. أعمل إيه؟
It's not your job to do cystoscopy. If you have a referral, refer her. This is and under the 2 weeks rule, this means that you are suspecting malignancy.
Yes.
You know that any malignancy, any suspicious malignancy, you have to refer her and under the 2 weeks rule. Like she cannot be postponed beyond 2 weeks. She have to be there within 14 days.
Okay.
Let's see the answer.
Okay. Answer is E. So any cancer, I will refer her. Presence of blood in the urine with no suggestion of urine infection is a worrying symptom that needs an immediate referral to the secondary care. Some units have advocated hematuria clinic for this purpose.
I will tell you one more point in this. She is coming to you as a GP. Has been brought to the GB. The GB. GB cannot do any invasive testing. If this patient came to you in urogynecology clinic, proceed for cystoscopy and bladder biopsy. But she is not coming to you as a urogynecologist. She is coming for her GB. This is a point in the exam. Know what is your level. What is the level of care this patient is seeking? If she is seeking a GB, you cannot do anything above the level of a GB. If she is seeking a urogynecologist, you cannot do the basic. If she is coming for a urogynecologist, this means that she is already referred by someone else. These tests may have been done. He will tell you she did this and she did this and she did this. Also for the questions that come with ST, he will tell you if you are ST2, ST5, ST3, he will tell you your level. So respect your level. This is a point here. Respect your level.
Okay.
Good point.
Okay, let's go.
41
let's go.
year. What?
Okay,
41-year-old woman present with a long history of probable recurrent urinary tract infection has been treated with can mute.
Yeah, go. I muted them.
Has been treated with presumptive antibiotics when she lived abroad. She has severe pain in the bladder area and also urinary urgency, but no leaks. She also reports occasional hematuria that resolves spontaneously. Serial urine culture have always been negative, including for fungus and atypical bacteria. Keyword هنا recurrent UTI.
Recurrent
presumptive
antibiotic. So without culture, presumptive, like they presume that this will be okay, so they give it to her. So I think this is without culture. But now she has sterile biuria.
She could be bladder endometriosis.
She has a
pain in the bladder, urinary urgency, no leaks, report occasional hematuria, resolve spontaneously, urine culture negative. What do you think?
This is, let's see.
Blood culture, post-viral cystoscopy referral, questionnaire, sound for urinary tract, urine analysis, culture, urine cytology.
Is it a symptom questionnaire?
No, not symptom questionnaire.
Because whether it is cyclical, not cyclical, and
no,
if it is a bladder pain syndrome,
look,
why does she have hematuria? If she has hematuria, there is some.
Yeah, look, you remember hematuria in young? what is the difference between hematuria in a young patient and hematuria in an old patient? In old patient, we are going for
Some
malignancy.
malignancy.
But for
And
the
in young, we are going more for cystitis or something.
yeah, and interstitial cystitis now is not diagnosed like this. You cannot tell interstitial cystitis without doing cystoscopy. You cannot diagnose interstitial cystitis without cystoscopy. So you know here
By
what
cystoscopy.
yeah,
By-
this is what
By what I can interstitial cystitis without cystoscopy or urodynamics?
no. Look, now
No urodynamics.
strict-
There is no role of urodynamics.
yeah, but they strictly put the termination interstitial cystitis if you found abnormal
spots
cystoscopy.
hot abnormal اللي هي كانت حد يفكرني بالسبوتس كان اسمها ايه؟ في سبوتس ماشي اوكي continue okay
Okay.
so what
okay,
I can think
So you have to look in order to exclude or confirm interstitial cystitis, you have to do a cystoscopy.
yeah
Okay, because now
So-
the new guy is a new talk said that interstitial cystitis is a pathological term. What
Yeah.
is the meaning of pathological term? You have to have histopathological
yeah
evidence of it. Okay,
so the answer D
yeah, answer is D, and let's see it.
yes the symptoms are suggestive of interstitial cystitis cystoscopy and a probable biopsy will help in the diagnosis. These patients are often mistaken for overactive bladder or recurrent UTI. Can someone tell us the key word of overactive bladder and recurrent UTI and cystoscopy?
Recurrent,
The same?
recurrent UTI, she will come with recurrent episodes of loin pain, frequency, dysuria, all the fever. Sometimes she will come with symptoms of pyelonephritis, and he will give you that the culture, when they did the culture, there is some growth of any type.
Okay.
Okay, this will be
Mm.
treated with antibiotic. Overactive bladder is overactive bladder is meaning that she is leaking. She cannot she
Scent?
cannot control. No, she cannot control the urge.
Mm.
When she has the urge, she cannot control the urination. She have leakage. Once she gets the urge, she will her brother will be very fast to void. Okay, and for interstitial cystitis, this is a pathological. She is having all over the place symptoms, but the most important thing that she is having blood in urine, and she is young. This is the difference between young patient blood in urine in young patient and blood in urine in old patient. In old patient, the first thing that come in your mind is that she is having some malignancy. But the same symptoms, if come in young, you will first go for interstitial cystitis. Okay. So let's go for next question.
Okay. Thanks, Dr. Amira. Number 4, 38-year-old woman present with urinary leakage on coughing and sneezing. She has completed her family. She had 2 normal deliveries. She also admits that she has difficulty holding on due to urinary urgency and frequent the toilet at least 7 times a day, but not at night. Anticholinergic haven't been helpful for her. يبقى ده mixed.
Urinary leakage on coughing and sneezing. This is
stress incontinence.
this is stress incontinence.
Okay.
Having difficulty holding on due to urinary urgency. Yeah, this is urge as well. So this is mixed. So what
Okay.
will you do? What is the investigation for a mixed? This one is, yeah. This is one of
Urodynamics.
the this is one of the indications of the few indications of urodynamics. Mixed incontinence. For mixed incontinence, it's better to go for urodynamic, especially now that medication also failed.
Yes.
So let's
urodynamics. Let's see the
yeah,
answer.
let's see the answer.
Urodynamics helps to a certain treatment plan if conservative measures haven't been helpful. يعني a certain treatment if conservative not helpful. Okay.
Okay, let's move on. Adolescent gynecology. This one also is good because it comes a lot in the exam. The difference between different types of primary amenorrhea. This comes a lot in the exam. So
yeah.
We have to choose the diagnosis. Okay.
Okay. 17-year-old girl is brought to the gynecology outpatient department with history of primary amenorrhea. On questioning, she admits to having cyclic abdominal pain, and increasing difficulty with not avoiding urine and defecation. With not avoiding urine. With
yeah,
17 years.
Not in. Look, when she goes for voiding, she have pain, but not during voiding. When she is going, when she wants to go, she will feel pain. But when she empty her bladder, she will feel release. This is a classic picture of this. So let's see.
Okay,
hematocolpus.
Yeah, this is imperforate, either a transverse septum or imperforate hymen, and you can differentiate them by examination. And also the difference between them is important in the exam because sometimes it will be transverse septum and sometimes it will be imperforate hymen.
Okay, let's see the answer, please.
Okay. Sorry. Hello.
Hello, أيوة. Non-canalization of the lowermost end of the urogenital tract in women may lead to hematocolpus, improper ectodermal development or derangement in canalization may lead to this condition. Examination reveals a bulge due to accumulated menstrual blood. Okay, يبقى هو improper في الectoderm development, ectodermal development.
As I told you, this can be either imperforate hymen or transverse septum. Both have the same picture.
Okay.
Okay.
Second.
Dr. Amira, معلش, I want to ask a question for the longitudinal septum. If we have longitudinal septum in the vagina, is it means it can come or no?
Yes. Look, longitudinal septum is a different thing entirely.
Yes, I know.
Because sometimes
what is the complication?
I'm telling you according to the reason. Maybe she is having a uterus didelphys. She has 2 uteruses. Uterus dideltus, she will have 2 uteruses and 2 vaginas. Sometimes the septum is just in the vagina, according to the where is the septum up to. If it is up to the fundus, this will be 2 uteruses
داي
and
دلفيسس داي
yeah,
اللي هي
but
داي
but if it is just in the vagina, it will not, but it will cause severe vaginal
dysmenorrhea.
bleeding. No, and you are saying about the complication. The complication will be during delivery and sometimes during intercourse. If there is aggressive intercourse or sometimes with regular intercourse, this septum may rupture. According also to its length.
Yes.
It has the most serious complication of it is bleeding. Is it's
bleeding
rupture,
by transection, by
rupturing and bleeding.
Rupturing of it.
Yeah.
It is okay. Because I read it and I cannot understand. Okay, thank you.
Okay.
20. Okay, second question, number 2. 21-year-old present to the gynecology outpatient clinic with department with complaint of not having periods after her premature delivery of 15 months ago. She didn't have lactation at all, and the baby have been fed with formula milk throughout. Her GP has recently recommended a thyroxine supplementation due to her weight gain and abnormal thyroid results. She mentions that she doesn't like coffee anymore, and she can't perceive not beer its aroma. ايه its aroma دي؟ can't perceive.
It's a smell. You know, she cannot smell, like she cannot tolerate the smell. This is like some abnormality with the smell. This is a typical picture as well. This is also a typical picture. She's coming after delivery. She never had lactation. She has never lactated, and now she has thyroid dysfunction. So this is something in the pituitary. What happened?
Sheehan syndrome. استني.
Yes.
بصي.
Why? Yeah, why are you doubting yourself?
أنا قلت أول impression وبعدين قلت استني ما أشوف الاختيارات التانية.
Why are you doubting? Look,
أصل شيهان دايما بتيجي بوست بارتم هامرج برضو ولا إيه؟ كان فيها بوست بارتم هامرج شيهان syndrome.
Yeah, but maybe it will not. She will not tell you about the hemorrhage, but she is telling you what happened after the hemorrhage. The problem is the pituitary. So for me, this is a typical Sheehan. The only thing missing is that she didn't tell us about the postpartum hemorrhage. But other than this, all the rest is going with Sheehan.
She loses smell and the thyroid will be abnormal and she has no lactation. Okay, and after delivery.
Okay, let's go see. Let's see the answer. Wait a minute. Okay. Sheehan is a postpartum pituitary necrosis happened due to diminished blood supply to the thalamus after a postpartum hemorrhage if adequate fluid replacement is delayed. It manifests as pituitary dysfunction, which is shown in this case as thyroid, hypothyroidism, plus the failure, so hypoprolactinemia, which led to this, and also there is a FSH and TSH is all over the place because she is not having her menses, including anosmia. Anosmia, this means she cannot smell anymore, or at least she have the smells feels funny for her, not the usual smells she used to smell, and thyroid dysfunction.
Okay, thanks so much. Number 3, 19-year-old girl present to the GB with intermittent lower abdominal pain and persistent vaginal discharge with no itching or foul smell. She mentions that she is nullipara and uses an IUD for contraception. It was inserted a year ago. 19-year, intermittent lower abdominal pain, persistent vaginal discharge, no itching or foul, وناليبارا وبتستخدم IUD for contraception بقالها سنة. وناليبارا هايبوسيميك ولا ايه ده؟ lower genital tract ثانية ماير
G. Actinomyces.
Yeah.
what?
Look,
Actinomyces
she have
is associated
IUD.
with IUD. With IUD because
She
it
have
has
IUD.
yes
She have IUD. The tricky here is the IUD. Okay.
IUD yeah. وفاول هو قال فيه فاول smell صح؟
You
Yes.
saw infection.
Foul smell.
Yeah, foul smell. This means infection. Infection with IUD, most probably actinomycosis.
Actinomycosis. Pelvic actinomycosis is associated with symptoms of irregular bleeding, discharge, abdominal pain, and sometimes a pelvic mass. She can be treated with specific antibiotics. Usually, persistent symptomatic infection may need removal of the IUCD.
Okay.
Removal of the IUCD.
Is the actinomycosis this one that have black dots like this?
Yeah, granules.
Yeah.
Okay.
Black dot granules, black.
Yes, yes. Why is at the streets of the IUD? Sometimes you
Yeah,
can see.
it's you can see it as black dots on the strip. Okay, number 4.
18-year-old girl presented to the outpatient department with cessation of her period that commenced at 15 years ago. She has been increasingly infrequent over the last 2 years, and she hasn't had a period for more than 1 year ago, a year now. On examination, it was found that she has a wide carrying angle, Turner.
Wide carrying angle, and she had her period, so she could be a mosaic.
Mosaic.
Turner.
Yeah, mosaic Turner.
Yeah, so
She needs karyotyping, no?
yeah. But now
Stay
she is Turner can lead to early ovarian failure, premature destruction of oocyte occur due to the presence of the 45+0 chromosome type. Sorry, 45X0. Sorry, my brain. Okay, so she is 45XO. This is what we are saying. Okay. Disorders of menstrual bleeding.
13-year-old girl is brought to the gynecology outpatient department by her mother. Her mother is concerned that she hasn't had her periods regularly. She attended menarche at 12 years and had been having periods once in 2 months and sometimes 3 months. She had a normal body mass index, plays sport regularly. Hypothalamus دي حاجة أكيد في الهايبوثالاموس صح؟ أو البيتيوتري. نشوف الأوبشن هو hypothalamic pituitary.
Let's do it. She is now 13 years. Hear me out. She is 13 years old. She is 13 years old. She got her period at 12. So she is in her first year after menarche. This is significant.
عادي. Yes.
This is nothing. She can
Yes.
have.
أيوة.
She can
reassurance.
Yeah. So here we will do nothing, just reassurance. Tell her this is normal. It can happen to a lot of girls in the first 1 or 2 years or even 2 years of their life. They can have irregular periods, and this is not something to be concerned about. Especially that her BMI is normal and she is plays sports regularly. but he didn't tell you that she is playing, like she is not a ballet dancer, she is not playing a vigorous sport.
Yes.
Okay.
Okay. In the first year of menarche. Yes. So the answer, reassurance as irregular cycles are common in the initial few months or years after menarche. There is no need for interventions until the cycles are excessively heavy or painful. إذا كان excessively heavy or painful.
But just show the
Okay.
options, no? What was J? We just want to see the options.
Yeah, J is reassurance. That's
Reassurance.
what
Okay.
yeah, because I didn't show the upper because it was already there in the lower part with the question. So it was already appeared. Okay, let's go for the next question.
23-year-old university student present to the gynecology outpatient department with prolonged bleeding lasting for 8 days during her period, although not particularly heavy. On questioning, she admits to having intermenstrual and postcoital bleeding intermittent. Having, sorry, الvoice, she admits to having intermenstrual and postcoital bleeding intermittently. She uses the combined oral contraceptive pill for contraception. Combined.
So
لها heavy bleeding.
let's see. She
but-
is 23
Infection.
years old. She
PID.
have 8 years. Let's see.
Chlamydia
How do
screening.
you think before the options I أكيد يعني
Let's
most of
okay,
you
well, let's
know the
see.
answer.
Let's see the keywords. The keywords
Sexually
here.
active.
She is sexually active. She is taking combined oral contraceptives. That means that she is not using, most probably she is not using the condom. She has
Heavy bleeding.
She has heavy bleeding and she is having intermenstrual and postcoital bleeding. Postcoital
Like
bleeding, this is
Cervicitis,
contact
endometrium.
bleeding.
Yeah.
So the
Postcoital
cervix.
bleeding is a contact bleeding. Contact bleeding usually tells you that there is infection.
Infection في السيرفكس بقى mainly I will search about the cervix.
No, it can be in the vagina as well. No problem, anywhere.
Sexually transmitted infections يعني we think about that or what do you think?
Yeah, about sexually transmitted. So we will go for chlamydia screening.
Chlamydia screening. Oh, okay. Or the answer if sexually transmitted, I will choose it also. So, okay. Okay, let's see the answer. How he write it.
Okay.
Okay, يبقى postcoital bleeding and heavy bleeding. Okay. Screening for chlamydia is helpful. Irregular bleeding pattern in young women who are sexually active is often due to chlamydia infection. Okay.
Okay, we have 1 minute. So let's stop this session and I'll send the link for the next session.
Time pass with you, Dr. Amira, fast.
What?
Time pass with you fast.
Thank you, my dear. Thank you. I'll just close this and send now a link so fast. Okay.
Okay, Dr. Anna. Okay.
Okay. Thank you all. My it doesn't want to close.